And thank you for having me here. And I will just first begin with a confession, because you will hear me talking with a Swedish accent, and I will probably using the wrong grammar. And I have also used Google Translate, so maybe there's some words that you don't recognize. But if you use your imagination, I think we should be getting along quite well. So is that okay with you? Yes, good. My name is Anki, and I'm a specialist nurse in oncology, and I've been working at my department for about 17 years. And I work, as Paul told me, in Sahlgrenska University Hospital, and I will tell you a little more about where that is. At the moment, I'm working as a quality and safety development leader, and I have done so for about 4 years, perhaps. And before that, I worked in inpatient care. And when I became a quality safety improvement leader, I shifted my work from clinical practice and worked 60% perhaps, and then 40% as a quality improvement leader. But now, the last couple of years, I work 100%. So I do not do any clinical work. Perhaps during the summer, if there's shortage of nurses. So every year there is so. I work some weeks during our wards. Okay. So here is my region. Sahlgrenska University Hospital is located in Gothenburg area in Västra Götaland region. And Sahlgrenska has about 16,200 employees and about 1.3 million healthcare encounters. And most of them are outpatient visits. And Sahlgrenska University Hospital is one of the largest hospitals in Europe. And it serves the people of Gothenburg, of course, and it's also a specialist hospital for the whole region. And the region is in the western part of Sweden. So it also takes inpatients from all over the country who require particularly difficult procedures, advanced procedures and treatments. And we call them national health care assignments. I don't know what you call them here, but. And on the picture, you could see Västra Götalands region and the whole, lots of hospital. And let's see if I manage this. Sahlgrenska is here. And we have plenty of hospitals around the region. And that's important for my presentation, because we are trying to get, we are having a standardized education program, and we do it for the region. So that's why this picture is important. This is my department, Department of Oncology. And we have 370 employees. We do about 20,300 doctors visit last year. And we have 37 hospital beds spread on 3 wards. And we have a radiotherapy, of course, and brachytherapy. And we have 3 daycare units as well. And since the house is quite small, we spread and take a bit elsewhere in Sahlgrenska. So we have in Östra, it's in the eastern part of Gothenburg. We have a daycare unit, and we have a daycare unit also in a different building. So the building is too small for our organization. So when I started, we also have a cancer rehab. I forgot about that. That's important as well. When I started in 2000 at this clinic, we prepared our chemo ourselves. And for about 4 years we did so, but in 2004 we get the chemo from the pharmacist. So at the moment we don't prepare any chemo ourselves. And when that started to happen, it was really, revolution. It was a lot of spare time we could have with the patient instead, because it took a while to prepare this chemo. We have been a group of nurses at our clinic who has been working. We had a great interest in chemotherapy and cytotoxic drugs, and we were responsible on each unit. So we're a group from all the organization, and we gathered to talk about routines, education, and so on. And that group did also start with the training in more, not the e-learning training, an ordinary lecture training for the nurses and the assistant nurses as well. We are still, that group exists still, and we are discussing and we are meeting about twice a term, so 4 times a year. And if we need, we meet more often. So from the day I started at the clinic, I have been working and fighting for safe procedures handling these drugs. And at that time, we hadn't got any wipe samplings, and we really fought to have that. I will tell you more about this later on, because that's very important to do wipe samplings. I checked some figures, yeah, from January to July this year, and we have given 10,386 chemotherapy treatments IV until then. So this picture shows the chemotherapy preparation in the whole Västra Götaland. And the pharmacist, as I say, prepare it for the whole region. There is nobody who prepare it themselves. And totally in 2013 it was around 61,000 preparation. And they count, preparation, for a patient. So it could be various regimes. And here is an update on just the chemotherapy IV in outpatient settings last year. And this is Sahlgrenska, here is Sahlgrenska, and it stands for quite, the largest 49% of the IV, just the IV this. The other hospitals has less. And this statistic is taken from the classifications codes for, the code, I don't know what you call it, DRG? Yeah. It's the classification code for each things you do.
Okay.
Yeah, you know what I mean. Yes. Yes, exactly. Procedure codes. Yeah, that's right. So here as well, there is, one patient can have 5 days of treatments. So it's just counted once. So we handle a lot of chemotherapy in the region. And as we have Swedish regulation, of course. And according to the Swedish regulation, work environment authorities, preparation and administration shall only be carried out by persons who have undergone special education and have knowledge about possible health risks and the protective measures to be taken. And this is to reduce the risk of contamination and exposure of cytotoxic drugs in daily work, as we have been talking about. And according to the regulation as well, the manager has a responsibility and a very important role in making the work environment as safe as possible, and have a responsibility to conduct annual risk assessment on the workplace, the work unit. And we haven't talked so much about risk assessment yet today, but I will tell you a little about that, how we do it in our place. So this is Nancy. She's my colleague, and some of you have met her. We work closely together, and we have been working close together with these topics from the day I started 2000. And before, like I told you previous, we had a local education program in handling these drugs. And these local education programs could differ depending who was the organizer, and there was no standardized education program in Västra Götaland. The course we had was on 2 days and was repeated once a year. And we noticed that adherence to procedures and guidelines was generally lacking in workplaces, and there was not always room for dialogue about risk awareness and the development of safe management routines. So, so to speak, the participant went back to the workplace and continued as usual, if you know what I mean. So we had this education program for 10 years. And in 2011, there were the establishment of the regional cancer centers in 2011, and it gave the opportunity to form a network responsible for introducing the education in the region and functioning as a course leader. So in Sweden there are 6 regional cancer centers who works in tandem with healthcare as a kind of knowledge and development center. And thanks to that, we formed a network to take over this responsibility for the education in cytotoxic drugs. So we were a couple of specialist nurses, both working in oncology and hematology in our region with a great interest in these matters. And all of us had a responsibility in our own local education program, so to speak. And we took the course in Lund, in the southern part of Sweden, and that's the course that Jan will tell you more about, because they have in Lund, they were first with that e-learning program, and they had been doing this for a couple of years. But we in the Västra Götalands region, we did our own training, so we didn't send anybody to go to Lund. So we took the course, Jan's course. And Ida was our course leader. She's sitting over there. And that's the way I get to know her. So in this picture you see Nancy, and she is dressed properly. She has both, the arm, that is not needed, but she has a gown. We don't have the plastic gown. I saw it on your picture. That's forbidden. We use this gown. So how is this the start of the e-learning training program? So we started in spring 2012, and we just did it for the nurses. And just to tell you a little about the program, so the participants take part of film lectures and study material. And they answer multiple choice questions and descriptive, reflective questions. And each participant has about 5 weeks to complete the course, and a total of, it takes around 30 hours, which is calculated for each student. The course leaders, which are myself and Nancy and 2 other nurses and sister nurses, follow the participant during the weeks of education through the platform, and we respond to the submitted answer. And once all the questions are completed correctly, the participant is welcome to the course gathering, which is in the end of the course. And on this course gathering, it's about 4 or 5 hours, and it includes practical exercises such as demonstration of contents in an accident box, demonstration of protective equipment for administration, and how to handle excretions. That's a difficult word. Do you know what I mean? Yes. Yeah? And finally, they will conduct a risk assessment in group, because we want them to know what the risk assessment is. And they will do their first risk assessment at the course. And this gathering is a very valuable time for the participant, and they have a chance to change and share experiences. And we have very good, the evaluation tell us that this is really valuable and they really want to have it longer. They think it's too short of a time. We also show the PactoSafe for them, and we show them how to use it properly. And not all of them have that kind of PactoSafe, but almost everyone. And if they haven't got it, they will get it. In a course, there is about 20 students, and the course leader are responsible for about 5 students each to follow them during the course. And we have 3 courses per term at the moment. So I always guide someone through the course. And 2013 we also started to have the course for assistant nurses. I don't know really what that called in. They are not educated nurses, but they're just assistant nurses. And we also in 2016 we did a test project for physicians. And the total students that we have had since we started is 577 students. Okay. We did a survey in 2014. I took a course in quality improvement, and then I had the opportunity to do a kind of study, or it was in my exam. Since we during the discussions in the network, and when we saw the completed course evaluation and the talk during the course gathering, we understood that there was not always room for dialogue at the workplace. There was no time. The manager didn't think that was so important, so they didn't have the opportunity to talk about how they should do things. So we wanted to see what about the risk awareness, and if they have done the lesson at home when they are finished with the course. So the goal was to measure attitude and behavior changes before and after the education, and explore whether the course participant could inspire colleagues and their immediate supervisors to increase awareness about handling these drugs in the daily work. And it was also the aim to see if the supervisors carried on risk assessment and created the atmosphere that was gave the opportunity for discussions. Do you follow so far? Yeah, good. So we did a survey then. So a questionnaire was given to 153 nurses who had completed the course during 2012 and 2013, and also to their supervisors, 39. And the response rate were 66% among the nurses and 56% among the supervisors. So 102 nurses and 22 supervisors answered the survey. And like I said, it is important to have time for dialogue. And only 2 out of 22 supervisors had a standing point. I don't know exactly what you mean, but you know, agenda, the meeting agenda, and have a point, the topic, cytotoxic drugs, to discuss this matter. So that was not so many. After their employees have taken the training, 65% of them answered that they have had discussions 4 times a year or more on the agenda. And I think if we should do this survey now, it will be higher, for sure. By the way, this is Nancy taking the spill kit, our accident box. I will show you on another picture later on. 33 of the nurses answered that they had annual risk assessment, but 23 had never had them. And a large number of the nurses, 46, didn't know if they have had it. So they didn't know what it was to do a risk assessment. And when we asked the supervisor the same question, they answered that was 50% of the supervisors, they did not conduct annual risk assessment within their unit before they have gone the training. But after training, the figure raised to 75% of the supervisors that they have started to do annual risk assessment. 67% of the nurses felt that the climate, the atmosphere in their workplace about discussion of this risk management had become more tolerant and open after training compared to before the e-learning program. So that was good. And now it even higher, I think. So it has become more permissive and open atmosphere. The climate of talking about these matters have increased. We also noticed during the course gathering that several nurses didn't have a spill kit or an accident kit at their workplace. So we asked a question about this. And 25% of the nurses didn't have that. But after training, all of them have had installed a spill kit. And now, when we show the accident kit, you know, everyone is, yeah, we have it, so there's no problem. And one of the goals in the course is to be able to identify situations where you are at risk for exposure in your own workplace, and to suggest improvements at your workplace. So that's a descriptive, reflective question that we have. So we asked if they have been able to identify risk moments and propose improvements. And a majority of them had done so. When we were finished this survey, and I made the report. The report went out to supervisors, the regional cancer centers, and the clinical bosses in whole Västra Götalands region. So we have done a lot of improvements in the course since we started, and it was a result of this survey in a way. And we got a main course leader. So Nancy works 20% just with the course, 1 day a week. She has dedicated for the course, and that is paid by the regional cancer centers. Myself and the other course leaders do it in their, the daily work schedule. We also have made improvements in different chapters together with Jan, and we have updated some chapters and filmed and lectures. And we have done the course for the assistant nurses and the doctors, and that's specific questions for them. And as well, we are trying to have joint guidelines in Västra Götalands region, and now in the last year also on a national basis. So standardized guidelines nationally, with of course some local routines you must have. And we have noticed a positive attitude shift among health professionals and supervisors regarding the value and importance of appropriate cytotoxic drug management. And that's really important because at the moment, every supervisors, if there is a new staff coming to the unit, the ward, the clinic, the first thing they do is to put them up for the course. So we have all the old ones who still are working at our clinic have gone the course, but every new one immediately puts up for the next course if it's available. So every course is full. We have a dream, and that dream is that we would like to start a course for cleaners and for supervisors. And I have sent the dream list to Jan. We'll see about. So I hope it will be reality. This is the Swedish network. So several hospitals in Sweden and other regions have started this e-learning training program. And in this national network, we have regular meetings once a term, and we discuss the education, and we try to create a consensus about how to handling these cytotoxic drugs and inspire each other. And we spread the knowledge about this important topic, and we gain knowledge from each other. So this is a very important network. And we also invite researchers in the topic, in different topics, like, for example, wipe samplings or other. That thing we are seeing, we need for the moment. And in Sweden we have a national Swedish care manual, which is on the website. In Sweden it's called Vårdhandboken, but it's a care manual. And together with the network, I am the author in this chapter on management cytotoxic drugs, which we could influence. That's a good thing, that we could influence this chapter, who is spread all over the country. So that's very, very good. Okay, just some slides how they evaluate the course. This is our student in Västra Götaland. We have just had 3 physicians, and then the physician did the pilot. So we have done some changes in that course because they thought it was too much questions. They took too long time to do, so we have to do it in an easier way for them. So we evaluate each chapter and also the total experience of the course, and they fill out the evaluation form on the gathering, and they are not allowed to leave the gathering before they hand in the evaluation. And as you can see, it's very good. So how do you like to rate the course as a whole? You know, very good, most of them say, or good. And if you will be able to use what you learned in clinical practice, it's also to a very high degree, or to a high degree, the majority says. And if they want to recommend this course to a colleague, they also are very happy, and so we know that they like the course. They think it's a good course, but we could always improve, of course. Okay, I will tell you just a little bit about our accident kit. I don't know if you have a special one that you order or if you make one yourselves. We make our own spill kit, accident kit, and it's very, very easy. So here it is. It's in this box and with the manual on the top, and we have a sign, you know, a caution, don't walk here, to put out first, so no one walks in it. And then we have the goggles and our mouth shield. What do you say? Yeah, with mouth mask with the respiratory filter. And we have, you know, sleeve covers, the gown, of course, and then we have the waist bag, diapers and cleaners, plastic bags, shoe cover, and the protective gown, the gloves, of course, in different sizes, and all is in this kit. So this is a cheap way to have an accident kit. I could really recommend it. You save a lot of money, and you when it's used, when you have used it, you just fill it in with new stuff, and it's ready to go if you have another accident. We also have done wipe sampling, service sampling, and we did it for the first time at our clinic in spring 2016, and that was, of course, very late. But as I said, Nancy and myself and the other group have fought to make this happen. But the risk awareness, like I told about, the supervisors are, you know, on their feet to. They told us it was okay to do this, and we did first a risk assessment, because that's very important when you do the wipe sampling, to see where are the risks, where should I do the wiping, and this wipe sampling, like you said, Paul, you know, is used to the systematic environment work at workplace and allows you to map how well your routine works and to see if your daily work, daily practice is done in a satisfactory way, and then the risk assessment becomes more secure. So we took 10 samples or measure points, and it was cyclophosphamide, since this unit is a breast cancer unit, and a lot of cyclophosphamide is used. And this unit have done really a regular risk assessment from the beginning, long time ago. So they really are working very hard with this, and we found that cyclophosphamide was found higher than the reference value in one of the sample, and that was at the armchair, the patient, the armchair. So they changed. They were talking about when the result comes, you get a recommendation in the report what you should be doing to get improvement. And the improvement was, the suggestion was that you should clean it. You must clean it more often because we didn't do it in a proper way. It was not very high, but it was above the reference value. And here is just an example of the measure points, but Paul have gone through this, so it's nothing new. Here is like this kind of share. We didn't have any at the toilet. No. Sorry.
You knew it was positive. So.
Yeah. But we have men as well. It's not just breast cancer. Yeah. So, and we also took on top of the Pactosafe and the pumps, and but there was below the reference value. So they started to change the cleaning patterns and did it in a more often. This unit also have specialized cleaning people coming once a week to do the really heavy cytotoxic drugs cleaning, if you know what I mean. They go very thoroughly, you call thoroughly? No. To do all the surface. And they do everyday cleaning, the nurses and the assistant nurses themselves. But once a time they come, these special people. And we did a test again now in 2017 in the spring. We did an evaluation, and there were an additional 10 samples were carried out. And this time we had the opportunity to test it for several other cytotoxic drugs, such as fluorouracil, etoposide, gemcitabine, and of course cyclophosphamide. And the results show that it was still high at the armchair, despite the change of cleaning routines. But it was the only place that it was above the reference value. And they have done, you know, the risk assessment and been talking about, well, how come, how did this happen? But the truth was that they didn't have the good adherence to the procedure that they have decided. So there was a bit of cheating, or yeah. So that's why. So they will try again, and we were recommended to do another wipe sampling in 3 months. We shouldn't wait so long. We waited too long because we did it 2016, and now it was a year. So in about 3 months we should do another one. And several other units in our clinic and hospitals in the region have also done the wipe samplings. So it, you know, really started. That's good. And here is our box from the chemo comes in this box from the pharmacy, and we did also a wipe sampling inside this box, but there was none. There was not high. So, and here is just a couple of references, because we have done our wipe sampling through the work, the Occupational Health Institute. I saw a picture of that before, who is connected to the hospital, if you know what I mean. So they come out to us and help us with these wipe samplings, and we send our material to Lund, but all the occupational health services at the hospitals, you know, they help each other. And here is some articles about that method that we have been using. Okay, so finally then, this is a summary, and this education and knowledge are crucial when working to minimize risk and maximize safe handling of cytotoxic drugs, both for the patient, the place we work in, and us as healthcare professionals. And the primary change since we implement the implementation of the training is, you know, the positive attitude shift among health professionals and the supervisors regarding the value importance of this appropriate handling of cytotoxic drugs. So, well, thank you. And if there's, I don't know what kind of stuff you have, but so I brought some examples for you can look at if you want.
Okay, thank you, Anki, for your presentation about a very nice project that's going on in Sweden, in the Västra Götalandsregion. Any questions?
Hello. I just wondered, since you implemented your new e-learning training, has it meant that you've been able to retain any more staff at all? Here in the UK, I find in my organisation, we train a lot of staff. They stay for a very short period of time, and then they go off to bigger jobs, normally here in London, which pay a little bit more. So have you found anything similar in your own country?
As in Sweden, the nurses move like here in UK, I think. So I can't say if the program makes the people to stay, if that's what you mean. Yeah, because they quit their jobs because bad payment and you know that. Yeah. So but I can say that it's easier to recruit new staff because the supervisors, you know, they say at our place we have done the wipe sampling, or we will do the wipe sampling, and we have this e-learning training program that you will attend. So that's I think that is very important in the you know, for new employers. That's different.
More questions?
Hi, can I just ask, do you have university courses for chemotherapy or university accreditation for any of your courses?
No, they're not university credit. No, they get a diploma. So no. Is the course here? No. Yeah.
We run university.
Okay.
I apologise in advance for my nerdy chemistry question, but in terms of your spill kit that you put together, I just wondered, do you have like advice from your occupational department on the type of glove materials that you used in your cytotoxic accident spill kit? Because the materials for the gloves will have different breakthrough times for different materials like cytos. So I just wondered if you had some input there on what gloves to choose.
At my clinic, we only have that cytotoxic drug gloves who stands, you know, the best. We don't have any other gloves.
Okay.
Yeah, we can't find it. It's just these special gloves, and we have with long sleeves and with shorter sleeves as well.
Sure, thank you. There's quite a lot of difference in breakthrough times, that's all, for different materials. So it's good to know that you're using the best.
Yeah, so we are nitrile gloves, and we also use double. We have double gloves, yeah. And so when we do administration or handling, you know, urine and so on, we have the double gloves on.
Okay, more questions? I have one. You talk about that you still find contamination on the armchairs of the patients. Do you use a closed system for that, for the administration?
Yeah, we have closed system.
Okay, but still you have contamination there.
Yeah. We were talking about that, you know, some, not all have IVs, central IVs. There are still some people who has the ordinary, and they're sitting on, you know, the armchair, and so it's a very, how do you say, an area, sensitive area for contamination.
Yeah, I understand. Do you know if there is a difference between nurses who are doing this? If you discover that some have maybe more problem to manage this than others, that can make the difference?
You mean in the cleaning procedures?
No. When these armchairs are positive, but it can be related to that maybe someone has not a good attitude to do the administration or to withdraw the syringe needles, whatever. Have you observed that or not?
Oh, I can't say that.
Okay.
No. Sorry.
No, it's okay. More questions? Okay, thank you.
Thank you.
Well done.
Det var snällt.